The Trump administration's reckless assault on environmental regulations, a public health catastrophe. The Trump administration's relentless pursuit of deregulation has reached a fever pitch, culminating in a shocking announcement: the rollback of 31 crucial environmental regulations. This brazen attack on public health and environmental protection is not merely a political maneuver. It's a grave threat to the well-being of millions of Americans, a gamble with the nation's future, and a blatant disregard for decades of scientific consensus. The consequences, as revealed by a Guardian analysis, are staggering and deeply unsettling. This unprecedented wave of deregulation, hailed by EPA Administrator Lee Zeldin as the greatest day of deregulation our nation has seen, effectively dismantles vital safeguards designed to protect our air and water. The targeted regulations, meticulously crafted and grounded in rigorous scientific research, encompass a wide range of crucial protections. They include measures to curb harmful air pollution from vehicles and power plants, restrictions on the emission of mercury, a potent neurotoxin, and vital clean water protections for our nation's rivers and streams. The sheer scope of these rollbacks underscores the administration's blatant disregard for the health and safety of the American people. The long-term implications are catastrophic. According to the Environmental Protection Network, EPN, a group comprised of former EPA employees, these 31 rollbacks are projected to cause nearly 200,000 premature deaths over the next 25 years. This horrifying figure represents a direct consequence of increased exposure to air and water pollutants, leading to a surge in heart disease, respiratory illnesses, and other debilitating health problems. These are not mere projections. They are grim estimations based on the EPA's own assessments the administration now chooses to ignore. The economic cost is equally devastating. While the administration touts these rollbacks as cost-saving measures, the EPN report reveals a starkly different reality. The costs of implementing these regulations pale in comparison to the immense healthcare savings they generate by preventing these preventable illnesses and deaths. The financial burden of treating the increased number of pollution-related illnesses will far outweigh any purported savings from deregulation. Furthermore, the report's figures are likely underestimates. They often fail to account for numerous health issues, such as cancer, and entirely neglect the escalating costs associated with climate change-induced disasters, wildfires, floods, and extreme weather events, all exacerbated by the very pollution these regulations were designed to control. The impact on vulnerable populations is particularly alarming. Approximately 1 in 12 Americans suffers from asthma, making them exceptionally susceptible to air pollution. The current emission limits, slated for dismantling, were poised to prevent 100 million symptomatic asthma incidents by 2050. The rollback of these critical safeguards translates to a direct and severe threat to the health and well-being of millions of asthma sufferers across the nation. This isn't simply an abstract threat, it's a matter of life and death for countless individuals. The administration's assault on environmental protection extends beyond the mere rollback of regulations. It involves a systematic dismantling of the EPA itself. Hundreds of employees have already been dismissed, and plans are afoot to eliminate as many as 1,155 scientists, effectively gutting the agency's scientific expertise and research capabilities. The agency's Office of Research and Development, a vital engine of environmental innovation and policy, is also slated for dissolution. This deliberate weakening of the EPA renders it incapable of effectively enforcing even the remaining environmental regulations, creating a dangerous void in oversight and accountability. Environmental groups have vowed to challenge these rollbacks through legal action, facing a weakened EPA struggling under a proposed 65% budget cut. The legal battles that lie ahead will be protracted and arduous, placing an immense strain on already depleted resources. Christine Todd Whitman, former EPA administrator under George W. Bush, highlights the practical challenges of rewriting regulations, emphasizing the necessity for robust scientific justification. She also underscores the chilling message sent to businesses: a lack of enforcement. The implications extend far beyond immediate health consequences. William Riley, former EPA administrator under George H.W. Bush, paints a bleak picture, warning that these actions could plunge the nation back to the pre-1970s era, an era characterized by smog-choked cities and chemically polluted rivers that literally caught fire. This is not hyperbole. It is a stark warning based on historical precedent. The Trump administration's justification for these actions centers on boosting the U.S. car industry and advancing artificial intelligence. These claims, however, are thinly veiled attempts to justify an environmentally reckless agenda, prioritizing short-term economic gains over the long-term health and well-being of the nation. The rhetoric employed, describing the environmental protection movement as a religion, is a cynical ploy to distract from the devastating consequences of these actions. The rollbacks represent a profound betrayal of the EPA's founding mission, a mission established in 1970 under Republican President Richard Nixon to protect the environment and public health. This fundamental shift in priorities, coupled with the installation of industry lobbyists in key positions within the EPA, reveals a disturbing prioritization of corporate interests over the health and well-being of the American people. The consequences of this administration's actions will be felt for generations to come. The devastating health impacts, the economic burdens, and the environmental damage will cast a long shadow over the future of the United States. The rollback of these 31 regulations is not simply a policy decision. It's an act of environmental vandalism, a betrayal of public trust, and a profound threat to the health and well-being of the American people. The silence of those who stand by and allow this to happen is complicity in a public health crisis of immense proportions. This is a fight for our collective future, a fight that demands immediate and decisive action.